Hi everyone, my name is Allie and I'm a mom and a board certified registered nurse. I've been a nurse for the last 11 years. I hold board certifications in geriatrics and nursing executive function, or nursing leadership for short. And today I want to talk to you. I've also cared for COVID patients as recently as a month ago. And today I want to talk to you about something that I think is a problem and is an increasing problem as we go through this pandemic. And that is something called omission, or the act of omission, not telling the whole story. And I want to talk about omission when it comes to children, specifically in COVID-19. One of the things that you recently have been seeing on the news a lot of is COVID positive children who are hospitalized. And I want to dig into that some, because there certainly are COVID positive children who are hospitalized because of COVID. But there's also a large amount of children who are hospitalized with COVID. And I want to just get into what that looks like. So children from whenever we first had a hospital and well into the future will be hospitalized for musculoskeletal injuries. They'll be hospitalized increasingly in the world we live in for mental health. That's a big reason why children and teenagers are hospitalized. Depression, psychosis, unmet anxiety needs. That's a big factor for children being hospitalized, as is endocrine disorders such as diabetes, stomach pain, big reason, infections, including respiratory infections, and influenza, COVID, pneumonia. Those are some of the top reasons why children are hospitalized. And I just want to express my concern with how COVID-19 in hospitalized children is being presented. There's no distinguishing difference when they report 20 children hospitalized with COVID. They're not distinguishing that 20 children are hospitalized. Joey has diabetes. Sally has a compound fracture that she had to be hospitalized for. And they also tested positive for COVID. They're not in the hospital because of COVID. They're in the hospital for their diabetes. They're in the hospital for their compound fracture. They may be asymptomatic for COVID, having no symptoms at all, but they were administered a test because they were hospitalized, because we're in a pandemic, and they tested positive. Those children's numbers, that their COVID positive test is recorded when you hear on the news there are 20 children hospitalized with COVID. I hope you can appreciate what a problem that is. That's not telling you, the person turning on the evening news, that there are 20 children with severe respiratory illness, so much so that they had to be hospitalized because of COVID. Instead, they're telling you 20 children are in the hospital with COVID. You can have COVID, especially as a young child, and be asymptomatic and be okay. You also could be a frail respiratory case where that COVID is really holding you down. But I think it's concerning to not present accurate facts. So I just wanted to dive into that a little bit more. One of the ways that I want to kind of show you what we're hearing in the news and what is actually fact is to actually show you facts, right? You hear trust science, you have your own personal experience, and then there's boring facts. And today I want to dig into boring facts because I don't find them so boring. So I'm gonna change my screen here so that you can see what I'm talking about. So you can see that I have the data.cdc.gov pulled up. Anybody can pull this up. This is public for anybody. I can leave this link down below as well in the video description. I just want to review a couple things real quick here. So this is data as of May 26, 2021. The period of time that we're looking at is January 1st, 2020, beginning of the pandemic, to just a week ago, so May 22nd, 2021. The state I currently have highlighted is Vermont. We're including male and female sexes here, and we're looking at age groups. And what we're looking at is, we're trying to be morbid here, but we're looking at COVID-19 deaths. because that's what we're interested in, right? Like, how many children are suffering bad outcomes from COVID-19? And what I want to show is that in Vermont, male, female, ages infancy, 0, to age 17, 0. COVID-19 deaths, 0. No children in the state of Vermont, ages infant to 17, have died from COVID-19. Total deaths, 37. They've died of other things, but no children have died of COVID. And again, this is the period of time that we're looking at. So, do the math on that. It's over a year. What is that? 16 months time period that we're looking at in Vermont, right? Vermont's not a highly populated state. I live in New Hampshire, so I'm sorry, I don't live in New Hampshire. I live in New England. So I just want to highlight some of the states with some of, we'll go with Maine, which is again not a very densely populated state, but we're gonna cover a lot of them. So here we are with Maine. Same data, right? Like same start date, end date. Maine, male, female, ages infant to 17, 0. COVID-19 deaths. There's been 0 children in Maine, 0 teenagers, up to 17. We might be able to dig a little bit deeper. So we'll go into some more stuff. Total deaths has been 145, but 0 from COVID. Let me scroll down a little bit here. So you see 0, 0, 0. 15 to 24, all sexes. There's not a 0 here. That means somebody in that age group, male or female, has passed away from COVID. Numbers less than 10 are not recorded. They're left blank, but not a 0. So there's either 1 to, not 10, so 1 to 9. At 10, they do start showing the numbers who have died from COVID. For privacy reasons, they won't show numbers less than 10 because it allows people to figure out who those people are, because people in those young age groups aren't dying frequently. So, let's scroll down. Okay, so here we are, Maine, all sexes, 40 to 49. So male, female, for the last 16 months, there have been 17 people in the state of Maine who have died and had their death certificate say primary cause of death is COVID-19. And you can see the different age groups as we go. Again, I have male, female selected. Scroll down here. And you can see what happens as the age goes up. Your age goes up, your comorbidities, or how many chronic conditions you have, also increasing your risk for death from COVID-19. The cool thing about these charts is right now we're looking at male, female, but you can actually go to just male and you can look, and it's broken down by male. So you can see in the male category for the state of Maine for that time period, nobody under 1, nobody 0 to 17. And so obviously in this smaller bracket, nobody. In this smaller bracket, nobody. And even actually all the way up to age 24 in males, nobody has passed away from COVID-19. You can go down to females. Here we are, 0 to 17, nobody's passed away. But then when you get to this 15 to 24 category, which was blank, from which had a 0 for men, does not have a 0 for women. That means somebody between the ages of 18 and 24 passed away with COVID-19 as their cause of death. You can see 25 to 34, nobody has passed away from that. So I just want to try to help you in reading this data, because I'm strongly encouraging you to get facts and to know numbers. A lot of parents are going to have to make tough decisions coming this fall with their children being asked to or being required to get a COVID-19 vaccine. And as a parent, I have to pause and I have to know data like this so that I can make an informed decision for my child. I don't want to put my child at undue risk of a COVID-19 infection, but I also don't want to put my child at undue risk from an experimental vaccine. And with the numbers that I see, no child has died from COVID in the state of Maine. Let's check other states. Again, we already looked at Vermont, so let's look at New Hampshire. So New Hampshire, here we are, same time frame, all sexes, 0 to 17, 0. COVID-19 deaths, 0. No infant, no 2-year-old, 3-year-old, 4-year-old, 5-year-old, 6-year-old, 7-year-old, all the way up to 17, male or female, in the state of New Hampshire has died of COVID-19. Let's look at Massachusetts. Obviously, Massachusetts has a population density much greater than Maine. Massachusetts. Holy cow, I'm struggling today. Here we go. All right. So we see different facts here, right? We see no 0, which means, as I mentioned before, that somewhere between 1 and 9 children fall in that category, that there have been deaths. So we can dive into that data a little bit more by scrolling down. I have male and female selected here, so we want to scroll down to male. There's no 0, so somewhere between 1 and 9, we don't know how many, for privacy reasons, have died. We'll go. All right, we get a little bit more information when we come under female. So under 1, in the state of Massachusetts, 0 females have died of COVID. 1 to 4, in the state of Massachusetts, 0. 5 to 14, 0. And obviously you can look at this data for yourself. Again, we don't know. Is it 1? Is it 2? Is it 8? Is it 9? Based on some of these zeros, I would tend to say that these blanks are closer to the 1, 2, or 3 mark than, the 8 or 9 mark as far as casualties. So it's important to know facts and to understand what the true risks are to different age groups, different people, right? Here we are, Massachusetts, males, 75 to 84. Look at the deaths from COVID in this age group. These are people who are advanced in years and most likely have comorbidities that put them at increased risk. But look at the difference when you get under 1, 0 to 17. It's hundreds of fold. Let's do one more. Let's do Connecticut, because that will be a good segue into the last thing that I want to show you guys. So here we are, another New England state, Connecticut, 0 to 17, it's blank, which means somebody has passed away from COVID-19. 1 to 4-year-old, it means somebody basically 5 to 17 has passed away from COVID-19. Let's get a little more info and scroll down because we're looking at male, female. So let's go to all males. So we see some zeros in there. So you can use that data to help you kind of figure out exactly what age group that person was in. Let's go to females. So it looks like somebody in the 5 to 17 range passed away from COVID-19 in the state of Connecticut. But certainly when you turn on the news, I feel like we get a different picture, right? Like I've just showed you that the state of Vermont, from ages infant to 17, male and female, have had no deaths in this time frame, 14 months, 15 months. So state of Vermont has had no casualties. The state of New Hampshire has had no children die. The state of Maine has had no children die. Massachusetts and Connecticut have had casualties, somewhere less than 10 and greater than 1 children in those states, in that age group, in this time frame have passed away. So that this is just leading me into the next thing that I want to talk about. What is the threshold for you as a parent to decide my concern for COVID-19 is greater than my concern for any potential side effect from a messenger RNA vaccine or from an adenovirus type vaccine? So, Johnson & Johnson, AstraZeneca are adenovirus, and then you have messenger RNA, which is the Pfizer vaccine or the Moderna vaccine. Those are, the 2-shot vaccines versus AstraZeneca versus Johnson & Johnson, which is the 1-shot. AstraZeneca is not available in the United States at present. Unless you're living under a rock, you've heard about blood clots, you've heard about issues. But I don't know that we're always hearing about everything, right? There's omission in the news as far as how many children are actually dying. It seems to be a more grim picture. But I want to just show you something. So, I'm just in a search screen because I want to show that anybody can do this, right? 18 teens hospitalized after COVID-19 vaccine. So, what is coming up here is Connecticut, 18 cases of heart problems in young adults after COVID-19 vaccine. I'm going to scroll down, okay? Mom of Connecticut teen speaks out after son suffers heart condition. At least 18 teens and young adults in Connecticut have shown symptoms of a heart problem after receiving the COVID-19 vaccine, specifically Pfizer. That is the vaccine that's approved right now in children as young as 12 years old. Connecticut has seen 18 cases of heart inflammation, what's called myocarditis, inflammation of the heart tissue. Did you know about this? Because I didn't know about this until I heard about it in a newsletter and then investigated myself. Again, I'm using Google to search this information. We're talking just about the state of Connecticut, which I just showed you. Connecticut has somewhere between 1 and 9 children who have died from COVID. But just recently, in the span of a month, if that, 18 teenagers have been hospitalized for myocarditis. I think it's important to have facts and to understand that you're not always having all the truth brought right to you. So I just want to leave you with a quote, and that is that deception by omission of the truth is as bad as a lie. That's everything I've got, guys. I wish you all the best. Take care.